Hello, and thank you for your interest in the Public Health Dental Hygienist training. This is Laura Scully, the 2018-2019 President of the Illinois Dental Hygienists Association. This overview of the training should provide guidance to someone interested in pursuing the Public Health Dental Hygienist certification. By the end of the presentation, if you have questions that were not answered or require further clarification, please reach out to us. The contact information will be provided. The objectives of this presentation are to describe the qualifications of a clinical dental hygienist to initiate the training, to identify the settings in which to practice as a public health dental hygienist, to explain the supervision guidelines, to outline the topics of training, to identify the criteria of the training as indicated in the legislature, and to summarize the supervision agreement between the public health dental hygienist and the supervising dentist. Here's the mission statement of the Illinois Dental Hygienists Association. Our mission is to improve the public's total health, to advance the art and science of dental hygiene by ensuring access to quality oral health care, increase the awareness of the cost-effective benefits of prevention, promote the highest standards of dental hygiene education, licensure, practice, and research, and represent and promote the interests of dental hygienists. As you can see, this public health dental hygienist training and certification and the access to quality oral health care of the public are key missions to our association. If you are interested in membership, information is provided at the end of the presentation. So let's start with the qualifications to start the training to be a public health dental hygienist in Illinois. You must have your registered dental hygienist Illinois license and have worked 2 years of full-time employment or have 4,000 hours of clinical dental hygiene experience to begin the training. You might wonder, where can you practice as a public health dental hygienist? As you can see, there is quite a list of locations, such as federally qualified health centers, often abbreviated with the initialism FQHC, a federal, state, or local public health facility, a Head Start program, a special supplemental nutrition program for women, infants, and children facility, and a certified school-based health center or school-based oral health program. So how does this work? After you achieve your public health dental hygienist certificate, a public health supervision agreement is written with a licensed dentist. This document would have specific standing orders or policy guidelines for procedures that are to be carried out for each location or program. The public health dental hygienist is allowed to treat patients prior to a dental exam, and the dentist need not be present in the facility. The patient population includes Medicaid-eligible individuals and patients who are uninsured and with income less than 200% of the federal poverty level. As outlined in House Bill 2676, the Public Health Dental Hygienist Training Bill, the agencies authorized to provide training include educational institutions accredited by the Commission on Dental Accreditation, such as a dental or dental hygiene school program, a statewide dental or a dental hygiene association approved by the Illinois Department of Finance and Professional Regulation to provide continuing education, and programs that have developed and conducted training programs for expanded functions for dental assistants or dental hygienists. We've mentioned quite a bit of information, but now let's get down to the nitty-gritty, the actual training. 42 hours of structured continuing education specific to public health. Just so you know, this coursework can be applied to your 36 hours of continuing education per 3-year licensure period. However, remember, only 18 hours of online coursework is applicable within a 3-year licensure term. The 42 hours for the public health dental hygienist breaks down to 29 hours of required coursework, 5 hours of additional coursework, and an 8-hour in-person review and comprehensive exam. The next slide will further explain the specifics. There are 6 categories in the required coursework, each with a designated number of coursework hours. Emergency procedures for medically compromised patients is 5 hours, pharmacology, 5 hours, medical record keeping procedures, 4 hours, and geriatric, pediatric, and pathology are each 5 hours. In regards to the additional coursework, the topics include special needs dentistry, teledentistry, nutritional needs of geriatric and low-income patients, communication techniques with non-English speaking patients, cultural competency and professional ethics. You can mix and match as you choose the additional coursework topics, a total of 5 hours. And finally, the 8-hour in-person review and exam. A prerequisite to register for the review and exam includes documentation of attendance of both the required coursework and the additional coursework. These documents are submitted to the organizing agency for verification. Keep in mind the concentration of this review and exam are exclusively related to the required coursework, meaning geriatrics, pediatrics, pathology, pharmacology, medical record keeping, and emergency procedures for medically compromised patients. A certificate will be provided after the exam scores are calculated. Once the certificate is dispersed, both the public health dental hygienist and the supervising dentist keep a copy. Oh, as a reminder, Illinois Public Act 099-0680 requires an annual completion of 4 hours of continuing education in public health dentistry. As a public health dental hygienist, the Division of Oral Health in the Illinois Department of Public Health has documentation to submit annually tracking the patient population, location, and type of setting where care was provided. This form is signed by the public health dental hygienist and supervising dentist. The slide here provides a link to the above-mentioned paperwork. Where do you go to find the public health dental hygienist continuing education courses? Currently, the ADHA website has many self-study CE courses available. The Illinois Dental Hygienists Association and other agencies plan to offer CE courses appropriate to the needs of the dental hygienist pursuing the public health dental hygienist certification. Our goal is to limit the financial burden of you who are seeking this certification. Many ADHA self-study courses are approximately $20. In a 2020 date for the 8-hour review and exam is forthcoming. There you have it. This is basically what's involved to achieve the public health dental hygienist certificate in Illinois. As we've tried to thoroughly explain the public health dental hygienist training, you may still have some unanswered questions. As I stated in the beginning, please don't hesitate to contact IDHA for clarification via email, mail@idha.net, phone 800-550-4342, or mail 1000 North Rand Road, Suite 214, Wakanda, Illinois 60084. Or look for us on Facebook, Illinois Dental Hygienists Association. Message us. If you'd like to join the association, click on our web page, idha.net, and click the link to join. You can contact ADHA at adha.org or by phone 312-440-8900. We look forward to assisting you in any way we can. Thank you again for your interest.